like to thank you for joining us today for designing senior housing for safe interaction in the age of COVID-19. My name is Jennifer Molinsky. I'm a senior research associate at the Joint Center, where I manage our research on aging and housing, and I'll be moderating today's webinar. Before we begin, I just wanted to begin with a few logistical pointers. We plan to close out our session today after the discussion with questions from the audience. Please feel free to submit questions at any point during the webinar using the Q&A function at the bottom of your screen. Because of the number of people tuning in today, we'll be keeping everyone's line muted throughout the webinar. And lastly, we are recording the webinar and posting it to the Joint Center's website. Now to our panelists. We're joined today, very fortunate to be joined today by three guests who bring a wealth of information and experience to this topic. I'm going to introduce them briefly now, and I will stop sharing so you can see their actual faces. We're joined today by Patricia Gruits, architect, the senior principal and managing director of Mass Design Group, where she leads projects in health, education, and equity, and she will present the new guide that she and her colleagues have produced. Sandra Henriquez is joining us. She is currently executive director of the Detroit Housing Commission, previously the assistant secretary for public and Indian housing at HUD, and also has Boston roots as the former CEO of the Boston Housing Authority. And so welcome, Sandra. And finally, we welcome Emi Kiyota, who is, Emi is the founder of Ibasho. She's the president of Ibasho as well, an environmental gerontologist, and among many fellowships that she has held, she is also a Loeb Fellow from Harvard. So thank you all for joining us. Let's begin. During the COVID-19 pandemic, most people have been advised to shelter at home. Our homes have always been important to health, though perhaps their role in health has been underappreciated. But now more than ever, we're seeing how where we live shapes exposure to risk, access to needed goods and services, and the extent to which we can engage with others. Statistics show that older adults have been more likely to face serious illness from COVID-19. And we've all seen the devastating stories of older adults living in nursing homes during the pandemic and the urgent efforts to address those through social isolation and other measures. For the vast majority of older adults who live in the community, roughly 90%, 97% of those 65 and over, housing and living situations can introduce a variety of risks and protections from the pandemic. Today, we're going to look specifically at senior housing, by which we mean age-restricted independent apartments that may offer supportive services and amenities. Community life, such as shared meals, planned social activities, spontaneous interactions in common areas, all of these are a central aspect of life in these buildings. However, these activities have been curtailed or at least made more difficult by social distancing guidelines needed to reduce the spread of the virus. So the central questions we'll want to answer today are: how can design address the challenges of reducing contagion while also supporting community in senior housing during the pandemic? And what lessons are we learning that can inform the design of senior housing going forward? So before we begin our discussion, Patricia is going to take us through the guide that she and her colleagues have developed. So thank you, Patricia.
Thank you. I'll just share my screen really quickly. Great, thanks again for that introduction, Jen. As architects at Mass Design Group, we are always seeking to promote justice, human dignity, and health in our built environment. Mass Design Group was founded 10 years ago in response to an epidemic disease, extremely drug-resistant tuberculosis, whose airborne transmission was exacerbated by spatial conditions of hospital wards and waiting areas. We've since partnered with organizations around the globe who are on the front lines of the world's major health challenges, from the cholera epidemic in Haiti to the Ebola epidemic in Liberia, designing and building spaces for care. This spring, as COVID-19 spread throughout the US, we were asked to help our partners in the healthcare sector by providing guidance on best practices for infection control to meet the urgent needs of our communities. One of the things that coronavirus has taught us is that we all need to think of health and wellness outside of the typical healthcare spaces, really to design better infection control throughout our communities. And as we all spend more time in our homes and our housing as well. Over the last few years, Mass has designed supportive and affordable housing projects, specifically age-restricted housing in the Boston area. And there are always tensions in the design field, designing for seniors. You know, how do we design for control and agency and autonomy? How do we design for flexibility and the specificity needed by seniors? How do we design against an institution and instead for a home? One project in particular that really has had a single mission or focus for our team in providing older adults, not just an opportunity to live better, but to live in community. And this tension was really brought to the forefront in our mind as we began to design for infection control and the ways that that contradicted some of the design intent around community and connectivity. We were really questioning how we were applying evidence-based design principles, not only to our healthcare projects, but to housing as well. Our process of creating this guide really started with those conversations and with a series of conversations where we were sharing ideas and listening to our partners and others within our network. We brought together housing developers, architects, operators, and funders who are all asking the same question. We know that seniors are at greater risk of this disease, and we know that social isolation is a threat. So how do we balance the infection control and social interaction? And this is the completed guide that our team put together. It frames the issue, explains our methodology, articulates the design principles and guidelines, and applies them to a case study. We synthesized these conversations and best practices into 8 principles for infection control. First and foremost, we understood that we needed to make spaces breathe better. Emerging research was showing that COVID-19 was transmitted through airborne particles. So it was essential to ensure that proper quantities of fresh air was delivered to residents. We needed to evaluate and maintain HVAC systems, but also supplement air dilution with operable openings. We need to think about how to sequence the flows through a space, leveraging wayfinding, signage, and spatial literacy of the spaces to help denote them as clean and dirty, and also direct residents, service providers, and visitors from unnecessary mixing. Another principle is to reduce pressure on these high traffic places. Typical social distancing recommendations consider those with mobility issues. Elevators, hallways, and shared amenities and other high touch and high traffic areas pose a greater risk. And so needs for additional seating in hallways to allow residents to safely pass each other or create designated spaces for queuing were all strategies. We need to group residents into villages, thinking about how to create small adjacent spaces or clusters that can offer interaction with a controlled set of residents who may share some of the same amenities without having to rely on potentially higher risk areas, such as large multi-purpose rooms or shared dining spaces. We needed to look to expand the threshold of the unit. As more food and services are brought to the doorstep of the unit, the entry must adapt to spatial and behavioral needs. So we need to think about signage, clearly to reduce delivery mistakes, and designate spaces off the floor for packages and deliveries to keep circulation clear and reduce tripping and fall hazards. We also need to encourage people to get outdoors. The risk of infection is lower in open air, so how can we increase the quantity and accessibility of outdoor spaces and create a diversity of spaces through scale and program? And additionally, simple processes of increasing protocols for high-touch, cleaning protocols for high-touch surfaces. Cleaning not only improves the safety, but also increases comfort levels and trust amongst residents. It also provides awareness of high-touch surfaces. We can use brightly colored paint, tape, and signage to do so. And lastly, embedding technology. Communications technology not only allows for critical information to be shared immediately, but many operators are currently using it to safely conduct wellness checks and reduce isolation. Standardizing that technology also creates equitable access to communication and reduces the burden on resident and service staff to have to work within multiple systems. One of the challenges that our team faced in adapting these principles that are in the guideline for housing is that it's really difficult to fully grasp all of the different variations of housing and care types that exist for seniors and the different levels of risk that exist within them. In our healthcare work, we were able to code or color code floor plans with clinicians to better understand which spaces were deemed dirty or had a high risk of contagion, for example, the patient room, versus clean spaces, which had a low risk, for example, a staff lounge. In housing, this distinction was more challenging. In housing, homes we came to understand, or we understood that they encompass more of a level of private to the public realm. For those practicing social isolation and social distancing, it's been typically adopted that where there are more people or there is a public area, there is greater risk of contagion. In spaces where there are fewer people or private areas, there is less risk. However, our team tried to understand this in a more nuanced way, seeing not only public and private spaces, but really a spectrum of experiences between them that included semi-public and semi-public spaces that change based on the resident's living and care situation and may ultimately be spaces where greater social interaction can occur. We define public areas generally to be within the public domain, somewhere between the curb and the entry. And our assumption is that in those spaces, an individual has minimal control over the infection measures and really relies on others, the government, policymakers, et cetera, to establish infection control norms. In semi-public spaces, these are more like the lobby and spaces of shared amenities. There's typically a shared agreement for behavioral norms, but the quantity of people or potentially the proximity to the public zones make it difficult for really an individual to enforce infection control measures. In the semi-private areas, shared circulation or resident social spaces perhaps really are defined by their scale, as they typically limit the number of individuals who are interacting together at one time. Users of a shared space are known and giving individuals greater control and knowledge of potential risks. And lastly, the private space, which is typically in the interior of the unit, where individuals have the greatest amount of control and where risks are the lowest. But we also recognize that there's not a one-size-fits-all situation in understanding the threshold between dirty and clean. This guide really attempts to introduce prompts to help residents, property managers, and visitors determine where each threshold lies and the key factors to be aware of to maintain infection control. In the guide, we tested these design principles and the framing of this thresholds through a case study. We selected a generic multifamily affordable housing project for older adults. We created this sample building that is multi-storied with a double loaded corridor located somewhere in the eastern United States. Additionally, we created some parameters for the housing to help us test these recommendations. We assumed basic services were provided to residents, but most care is delivered through the home health aides and other vendors. We then broke the study down along the public to private spectrum and looked to adapt the building design to address each of the principles we had laid out. Some of the design strategies are highlighted here. More of them are highlighted in the guide itself. But for example, in the public realm, we really look to highlight design opportunities where the buffer zone between the entry of the building and the curb, we could use design cues as a way to shape behavior, an opportunity to establish clear wayfinding, announce infection control guidelines, and reinforce how to help those unfamiliar with the building navigate it safely. In semi-public areas, we adapted spaces to allow for more people to come together safely, creating queuing spaces and directionality, and where possible, expanding the semi-public realm by co-locating basic amenities, which allowed residents to have greater range of their needs, for example, a grocery store or a health center, for those needs to be met in the building or within the campus footprint. It allowed them to gain back some autonomy without leaving the building premises. In the semi-private areas, which is typically in the floor of a building, there are opportunities to potentially transform underutilized areas, storage areas, additional circulation, or opening even a unit itself, to really embed programming not on the ground level, but on the upper levels, which is closer to the housing, and also breaking these relentless corridors into clusters of neighborhoods. And lastly, in the private realm, we looked for simple design strategies, expanding the threshold of each unit. On the hallway side, creating shelving or nooks or hooks for deliveries to be at accessible height and off the floor, creating spaces to accommodate the donning and doffing of PPE on the interior of the unit, creating sort of an entryway, creating spaces for accommodating balconies, which would allow residents to open their units to fresh air and interact with and socialize with neighbors at a safe distance. One of the main things that we're finding through this work is really that good design for infection control is also healthier design for communities, not just in senior housing, but in all the spaces we inhabit. We really see this guide as the beginning of a dialogue to further question how we can achieve healthier design for everyone. And we're excited to continue this conversation during this webinar and beyond. Thanks, Jen. I'll pass it back to you.
Thank you so much, Patricia. There's one quick question that came in online. If you could maybe speak for a moment about the outdoor spaces, because the question is that getting outdoors is seen as very healthy and important, but that's also one of the part of the public realm and the dirtier space. But maybe there's a distinction between the outdoor space that you're talking about.
Sure. When we describe the public realm, we're really talking about an assumption in sort of a multifamily development where there is sort of a front door condition and a curb. And that's really seen as this buffer zone of the public realm that we can actually have control over. But additionally, on a lot of these project sites, there are either outdoor courtyard spaces, there are additional sort of areas within the landscape that are on the property that are controlled, again, by the sort of housing operator. And a lot of those spaces are typically underutilized, and some of them can be reactivated through simple programming measures by setting up different scale or size landscape opportunities, whether that be areas for active interaction or for passive interaction, creating walking loops. And that's really where we see a lot of success and where our conversations with other operators and other developers and designers were pretty interesting to see how others were thinking about this evolution of the use of outdoor space for older adults.
Thank you. Emi, as an environmental gerontologist, you have a lot of experience thinking about these things, about how design affects older people's health and quality of life. So love to hear your reactions to the guide.
Yeah, I would first like to congratulate on you for such a useful and very proactive and practical and non-restrictive and also principle-based approach of the design guide, because I think just built environment really determine and enable people or disable people. It's not about the person itself. A lot of time older people are blamed on to say, well, they have this physical disability and this and that. But really, like how we design really determine what they can do. And I think this design guide kind of brought that issue on the surface. And I think the safe interactions, that I really like the term safe interactions, because a lot of time, when you design like elder care settings that I'm involved most of the time, we have conflicting values, which is like safety versus, privacy, or choices versus, again, it's a safety and things like that. But I think this design approach really kind of brought, it was much more proactive, which I found that it was very helpful. I think learning from this, it's just this COVID in terms of social interaction, I found that it's interesting because social isolation hasn't started just because of COVID. It was there for longest time. And I think that issue came to surface because of this. And I think we are facing this challenge and it's time to fix it at this moment. And I think, again, design can determine whether we're going to restrict their social interaction or not. And I think infection control is part of a key issues, because you've probably been hearing that in the nursing home and in independent living and some public housing, people are stuck in their own room because of the safety issues. And I think we really have to think about equity issues. Who is going to be affecting the most, which is normally a lower income people who has very limited access to, outside. So I think this kind of raised a very good, important issues. And I think just for the example of, I like the idea of, just making the private space much more comfortable. When, sometimes when we design, if we design like a socializing space, people are going to be socialized. There is a theory behind this. It's not going to work. You have to actually create enough privacy for people to feel like they are ready to go out to socialize. So just only on the socializing space is not going to solve the problem. But I think this guide really explained in the different scales and the layers of privacy that, in the private space, it is really hard to do for the public housing and then affordable housing community for senior care because budget is an issue. But it is really an important point that we really have to pay attention. If we want them, older people, to socialize, we have to provide enough privacy and comfort in their own private space. So that's what I wanted to share.
Thank you, Emi, and that's a great segue to Sandra, who's really seeing this firsthand in the housing that she oversees in Detroit. I'm wondering if you could talk about that, how the pandemic is affecting your residents and the kinds of things in the guide that you think could be helpful.
Thank you, Jen. It is interesting for me because the guide provides two paths for me to go. In reviewing and reading the guide, I'm struck by the kinds of activities, whether it's the cleaning schedules, whether what we do in a high traffic area, high touch areas. It, for me, helped affirm the actions that we've been taking at the commission since mid-February in anticipation of this pandemic and how long it might last. So we looked at high touch areas, we looked at how we're going to clean more often, what those protocols were. We looked at our ant handling systems and our roof fans and all those preventive maintenance items that we wanted to make sure we were attending to. The one thing we're doing now is we're thinking about how do you change out all of the individual air filters and individual units so that we maximize the cleaning of the air that's flowing into those units, since many of those units do not have windows that open, given that they're multi-story apartment buildings. We've been doing all of the signage, we've been doing all the recommendations that come through from the guide as well. Motion-free or motion sensor, freestanding hand sanitizers, wayfinding. Unfortunately, our corridors are double loaded and not wide enough, and so given the design of these buildings being done in the 50s and 60s and 70s, the kinds of design issues that are raised in the guide are not seen in our senior buildings. But the second path for me is to really think about how do I reposition my housing? And if I'm going to build new or if I'm going to retrofit and modernize, then how do I build these new design standards into those properties? How do I make larger elevator cabs, for example? Always a difficult and very expensive proposition. How do I build so that I can have some small common spaces, couches, resting places, both outside of people's doorways individually, but also in the corridor themselves. I think those are the kinds of things that we are finding would be really, really helpful for us as we move forward. In this pandemic, there are two other things that I find we've been doing. We don't have wide span internet access for people. So talking to residents, having residents connect with each other and their family members has been really difficult for us. And it's something I've been having conversations the past couple of weeks with my IT folks and my CFO about how we might pursue doing something in the interim that gives access to more residents, particularly our seniors. Twofold, not just seniors, but as we're talking about young people not doing in-person classroom activities anymore, going to school, how do we do that across our portfolio, both for seniors and for family members? And the other thing we've been thinking about in order to combat isolation is we've had resident services staff and property managers actually calling residents a couple of times a week just to check in. How are you doing? Take my number if you need something. What do you need? And a number of people have said that what they really need are groceries and access to groceries, particularly fresh fruit and meat and vegetables. And we've actually been doing some limited partnering with other organizations to provide those opportunities and then actually delivering to people's doors, unfortunately putting it on the floor and knocking on the door so that there's a contactless system of getting that food to those people. I think that those are the things that strike me now that we need to both think about in the future. And as earlier said, the design guide is really for all sorts of housing. It doesn't have to be just for seniors. And we really do have to think about the cost opportunity and how cost effective it is to prevent a communicable disease spread like COVID-19 up against the cost it might be to incur extra design elements in our properties. And I think that there's not a cost benefit analysis to be done. I think it's the right thing to do. That's why we have to do it.
Thank you so much for that. When you're talking about trends in design, you know, so there's the short term, as you said, and then there's what it's making you think about the longer term renovation of buildings, construction of new buildings. Patricia, I wanted to go back to you about that, you know, you're building on trends in this guide that are already at work that you have been working on with your colleagues and other buildings. Wondering, you know, which trends that you would pull out and really elevate as shaping senior design, the design of senior housing going forward, and also if there's anything you're seeing specifically out of the pandemic that you think will reshape how we think about design.
Good question. You know, I think to go back to one of the original questions that was posed by one of the participants was, you know, I think there will be an emphasis on access to nature in many different forms. I mean, I think, again, this idea that we're bringing evidence-based design from healthcare into housing, research proves that access to nature makes us healthier, more creative, more empathetic, more apt to engage with the world and with each other. So I think we will see a trend towards thinking about the outdoor space as part of a key program element and a key function of housing. I also think, you know, the trend in landscape has also been to program everything. And I think we'll also see where some of our passive landscape spaces, walking loops, nature trails will also, I think, start to be really great assets to encourage people to come back into multifamily housing. I also think that we might see a trend in some smaller developments. I think as Emi and Sandra both pointed to, like the elevator being this kind of moment of congregation and infection and high touch kind of surface and potential risk is something that that came up in a lot of the conversations we had with both designers, architects, and developers and operators leading up to this guide. Was what do we do? How do we, if I could add an elevator right now, I would. How do I do it? And so I think people will start to think about that in new development, how to maybe decentralize a central access point for, you know, multifamily housing. And I also think, I mean, one of the things that we've been working with on a number of our projects is this kind of emerging topic around trauma-informed design, really looking at how we can design for adults and individuals who have experienced trauma. And I think that, you know, this idea that we design for physical health, mental health, and wellness will become increasingly more important as we emerge out of COVID-19, as we realize how people have been living, how people have been sort of coping with social isolation or social distancing, and how that may have kind of layered on specific sort of instances of trauma that we can actually design for. And I think we'll see more, and I hope, this is my hope, I hope we'll see more of us in the design field really looking at those principles of trauma-informed care and seeing how they can apply to the design field.
Thank you. Emi, are you seeing any trends that you would like to highlight in the same vein as Patricia?
Yeah, I think I would like to highlight more on the village approach, which is like a size, I think. I think it's a two reason. It's infection control issues. You know, if you share with small number of people that you know in certain area, and you can actually develop more trust. And I think people will be more responsible because you know exactly just where, you know, who these spaces belong to. It's not like 200 people sharing the whole building, but 10 people actually share this space. So you have a sense of ownership and you can actually maintain better. And also, like talking about social interaction, anonymity is an enemy of all this. And if you have, again, 200 people in this place and they have no sort of units that you belong to, you know, it's, if you know your people in the same floor, in the same sort of smaller village, and you get to know people's name in the first name basis. But, you know, if you don't have that kind of cluster, and it's hard to kind of remember people. So I think it just, you became more isolated. And again, senior housing, people do need a carer to come in sometimes, you know, home care agencies or caregivers. You know, if an anonymous person is going to be walking around, and that is really you know, serious infection control issues, like in, you know, like a senior care settings, people are really advocating for consistent assignment for, you know, certain carers, because for the elders, because of the infection control, you know, just, so I think it's the size is control in a smaller scale. First of all, people have more sense of ownership to maintain the space better. And also people get to know people in the first name basis. And I think, you know, the natural disaster is something we didn't actually fix the problem. So we also have to think about it. But, you know, I think the natural disaster literature suggests that, you know, people who knows their first name basis in the community, they bounce back better. And also their casualty is lower. I think that probably fit into the senior housing issues. When we look at all these, you know, infection rates in the long-term care and all these big buildings, it's hard to stop infection once it starts, if it's a large scale.
And when we're talking about villages, what's the size we're talking about? What is the scale?
Well, I think it is. It's a great question for, like, it's debatable. You know, we don't really know exact number, but I think it's a little bit more than household level. So maybe like 10, 12 people. I think smaller is better, but not too small. But I think, you know, someone to my, so this is not a research base, because I haven't really found any research said this is a magic number, but, you know, there's someone who you can remember their first name basis every day. So, you know, it's going to be like a little bit, like a handful or a little bit more.
Got it. Great. So we're talking about these trends, but I want to turn now to Sandra. As we know, building and renovating subsidized housing is not cheap, limited subsidies and long waiting lists. We only serve a third of older adults who qualify for subsidized housing, a quarter of families who qualify. So we often hear that some design features are luxuries, like the balconies that might allow for fresh air or access to the outside. But we see how important it is, and we haven't perhaps yet quantified the value on the health side. So could you speak to this? How might we respond, you know, when we think about constructing housing, the cost, and also just maybe this question of how do we change the narrative a little bit?
That's a really good question. First of all, I'm a believer that when you're trying to change a standard, particularly on a national policy, it's best to have the science along with the narrative. And so to the extent the folks who put the guide together and others who really study these issues for seniors and others, to the extent that they come together and say, here are the real numbers, this is the fact, and get some of us then to actually implement and tell the story more anecdotally, add the narrative to the fact, I think that sends a greater message to how important it is and how real it is. And I think it just then takes some time to get traction. I think that always when you're looking at affordable housing, public housing, the subsidized housing, that people are always worried about, are there enough resources, enough finances to do the kind of deal that's going to be at least break even, if not profitable? Is it financially sustainable? As public housing operation has gotten more expensive in this country because it's gotten older and hasn't had ongoing, consistent upgrades, more and more of us are looking at other financing mechanisms to get it up and out of the public housing arena so that it operates like regular real estate. You can use the equity to enhance your property like everybody else does. And it's in that kind of mode where we can think then about, since we're controlling the resources more ourselves and not waiting for a federal subsidy or a congressional appropriation, that I think people will start to make the decisions about, I can do a little bit more of an amenity, operable windows, for example, and I can design those operable windows with safety in mind, but I can still get people to open them even at higher levels, higher floors in a building. Balconies always hard because it is seen as a luxury, and so how do we get the real world to understand a balcony might be seen as a luxury once before, as a market rate tool for renting, but that the principles now apply across the board. And that, I think, is a real hard sell for people to think about that. Although they used to think that garbage disposals and dishwashers in affordable housing units were a luxury and should not be put in. And so over time, I think that will evolve as an issue that people will realize, but I think the evolution will take too long, and we really do have to just start figuring out the resources to build the way we think the property should be built.
Mm-hmm. Patricia, how do you approach this as a designer if you're making a recommendation that unit include certain features? Do you get pushback? How do you respond?
I mean, I think that, Mass has always kind of been on the forefront of trying to understand and evaluate the value of good design, really understanding good design as fundamental. And so I think that there is an investment that we need as a profession who understands that what architects do, that design matters, that we need to come together and evaluate these specific elements to create the science and to create the momentum and the advocacy, not just for balconies, but for better design overall for these spaces, that all of us deserve good design, and that design does matter. And so that's typically how we approach it. We try to bring in the evidence base. We try to do our own evaluation when we can and seek those opportunities to bring our partners along in understanding the value. And I think that is if I call it an opportunity of COVID, it seems a little not quite right, but I think that is the opportunity. We're starting to make those connections between health and our built environment. People are feeling it on a daily basis. It's not something that is just a concept or something that we deal with in the future. It's something that we're feeling right now, and we will be feeling for the months to come. And so I think if we can come together, I think we can make the case together.
Right, and it's not just about the design of the building, it's the place it's located, right, too. So there's
Right.
the built environment outside your door, the sidewalks, the walkability, the amenities in your neighborhood, all that becomes really, really important too. Emi, so the organization that you founded that I failed to sort of describe at the beginning, Ibasho, means a place where you can feel like yourself, which I love. And through Ibasho, older people lead efforts to create physical places and community spaces in their communities. I wonder if you could speak to the role of older adults in the design process itself. So how can older residents be part of a design process as we create and renovate new senior housing that incorporates a lot of the ideas that we're talking about?
Yeah, well, I think I would like to start to share elders' accomplishments. So we create this community hub, and they create their own program. During the COVID time, they did not close the service. It is all operated by elders, actually. We don't operate them, we empower them, so they have their own organization. But, how are we going to, just view older people? Lots of time we view them as a vulnerable population that we have to care for and we have to help them. But, they have a lot of experience and wisdom. And, just like our elders went through tsunami and earthquake and depression time and the war. And, sometimes we discount all this experience, but I think it's time for us to, again, just rethink what they can do rather than only focusing on what they cannot do. And I think at the time of, we have done these 3 sites, all of them are post-disaster sites. So, we could just treat them as a vulnerable population, but what they wanted was to help others. That makes them happy. So I think I would like to stress the fact that, what kind of, how we view older people. And, you know, just we view older people as someone who can actually provide the experience, and they know about their life better than we do about what they want to live their life and how they want to live their life. So we empower and completely include elders from the very beginning to the end for the design phase. Of course, you know, some people don't understand the design language and all, so we use a lot of drawings and also group discussions, and it takes a little bit longer, but it's always well worth it. But at the same time, just because we created this Ibasho cafe with older people, and they actually renovate by themselves because the community needs changes. So, you know, how to develop the space that works for that person, but it is not like static, it is dynamic. So like we design in a way that people in the community could change. That's why they were able to adapt themselves to the COVID-19 to be able to keep that open. So you know, at the recovery time, hopefully it's gonna happen for the COVID soon. I really want to make sure that we will include older people's voices because they understand what they went through, and really encourage them to be a part of design process. Again, that is going to give more sense of ownership for them to be useful to others and being a part of the community, because social interaction means a lot. But I think what people want is a real meaningful interaction rather than like someone calling you and say they're checking on you, that's one. But I think what people really want is just do something to help others. So that's, I would like to be able to see that to happen. And I think the physical environments for the design process really help people to redevelop the sense of agency again.
Mm-hmm. That's great. I'm sort of dipping ahead into some of the questions that have come in from the audience, and because one of them speaks to this, I wanted to ask it now. And I think I'll direct this first to Sandra, but everyone's welcome to chime in. So the question is that there seems to be another subtle adjustment, just in addition to adjusting design and the physical space, almost the writer says a trust adjustment, that there's a new lifestyle requiring some degree of collective responsibility for our shared spaces. And how can residents be brought into that experience, to the redesign, or I think the question is both how do you build that trust, but also how do you maybe bring people in to help create that, you know, by working together with them on these kinds of adjustments that you're making. I don't know if Sandra, if you have any thoughts on that.
A little bit. That's a really good question. I think I always believe that the start of such a transformation, no matter how subtle, really has to be with sort of those of us who operate that property or who are building that property. We've got to change our mindset, again, like Emi said, of instead of we're doing it for someone, we're doing it with someone. And that is, for me, I find a sea change, particularly around providing management services and or design services when you're in a large public housing organization. It's a different way of thinking about your own responsibility and your own role. I think then once you've embraced that from a management leadership position, you've really got to think about then inviting residents in, and the only way to gain that trust is to do it over and over and over again and have it be consistent time and time again. And if it even means that you have a meeting that you repeat the same thing and the same sorts of meetings week after week or month after month, it is a long, sometimes feeling painful process, but it's the only way for people to understand that you're serious and you're consistent about that. And it'll get to a point, I believe, that when you go to the next property, you don't have to go through it the same way as the designer or the property manager. You simply have to ask residents who've been through it with you to talk to the residents who are about to go through, so that their reliance, the new group doesn't rely on what we would say as the property owner. They would rely on what people who have been through it have done, what questions they asked, how it affected them, how did they deal with the authority, and again, as you replicate those time and time again, that's how that trust gets built, and then you have to figure out how to move from that sort of tenant or resident participation to a sort of more of a civic engagement, a long-standing involvement by residents in every aspect, not just the design aspect, but every aspect of where they live and how they live in the community.
Thank you. That's great. Thank you.
Can I just add to that? Or?
Yes, I'm going to turn to you
Yeah,
next.
no, I would just add to that too. I mean, I think, you know, we really focus on a human-centered design experience and trying to understand the resident and the end user and also the organization that's participating in the community that surrounds the development. But one of the things that we really learned with seniors that I just share here because I think it helped build trust is that we really thought about our representation, about what we were actually asking people to look at or to engage with, looking at kind of both activities and physical representation, but also our drawings, just recognizing that, you know, a lot of older adults have visual challenges that may make specific colors or contrast levels very difficult to read, and be able to actually see the plans and images that we intended them to give feedback on. And I think it's just an important moment of trust building when you're actually able to design something to not just rely on like your typical representation modes, but really design something specifically to ensure that people can understand. And I think that's true of COVID as well. Thinking about the ways that we use color and wayfinding and signage, how that might be either graphic and not rely on specific languages that not everyone may speak, ways that we could use color and things that are legible to make people feel like they are actually being designed for as well, that their specific needs are being considered, which also, you know, allows them to participate with confidence.
I would also say, if I might, that you have to also be willing to have residents feel empowered enough to stop a conversation to ask a question, so that we're not using our shorthand or our jargon that we use all the time in the workplace and we have a common understanding, but to say, if you don't understand, let me break this down, not in a condescending way, but let me stop using my shorthand so that we all have common language and a common understanding of what we're talking about moving forward.
Okay. One of the questions that has come in is, I guess several people are asking, is about some of the ways to address these issues of infection control and community building in low resourced housing situations. So some of the things, Patricia, that you just spoke about don't strike me as high cost. I mean, certainly the additional elevator bay is going to be something that's out of bounds for many housers and especially at this particular moment in time. But some of the other things that you're talking about are really about wayfinding and paint and different things. I wonder if you might expand a little bit about some of the lower cost provisions that can be implemented.
Sure. I mean, I think, you know, we often talk about, I'm going to try to remember like the 4 S's, I guess, of things that can be adopted or changed for infection control. One might be the staffing. One is sort of the systems or protocols that are set into place. One is, sorry, it's the system. Now I'm going to forget the 4th one, but the last one is space. And I think that there are many different things that don't cost a lot. The different systems and protocols that can be set up, the different ways that we might actually look at, you know, cleaning protocols, signage, as I mentioned. I also think some of the outdoor spaces, you know, don't have to be high cost solutions. And it's really just about investing, you know, in creating those safer moments of interaction. I think in the guide, the one of the areas that I think is most interesting is really the semi-private areas, and what can be done sort of within even the double-loaded corridor, kind of very rigid sort of development, and places where, you know, we might think about, you know, again, creating pause points in a hallway so that people can passively safe each other and actually make eye contact or say hello. Ways that we might be able to think about directionality, again, understanding the pathways that people might take through a building where one sort of elevator or stair might go up and the other one might go down. Some of that is just about the different ways that we set up our systems to sort of allow people to interact without a lot of investment.
So I'm going to turn to another question that we're getting, and this resonates with something that the four of us discussed before we had today's webinar, which is the issue of climate. Patricia, you said that you set this guide with sort of the idea that you're on the East Coast somewhere, and we all know right now that we're in summer, and so keeping cool is a big issue for people across the country. Air conditioning, another thing that is often considered a luxury. An outdoor space on the other side, hand can maybe happen now, but it can't happen in the winter. So I'm curious if any of the three of you have any thoughts about the changing needs that you're going to see going forward into the fall, and what measures might be taken as the winter months get colder and some of the outdoor activities become harder. But I think the larger question is also back to that issue of what is a luxury, and what, how might we think about things like air conditioning and those things as necessities in today's climate. Anyone want to take that one? And Emi, I know that you have thought a lot about climate change, given your work. And so sort of like some of these things are going to resonate long after the pandemic is over. So trends in senior design that might address that.
Yeah, Patricia, do you want to just go?
No, go ahead. I'll
okay.
take my notes.
Oh, okay. Yeah, so I think, heat is one big issue. We used to have like a cooling center, which cannot be done because of the COVID time. So, I think it is more than a luxury, it's a necessity to provide air conditioning, because it's life and death situation and housing situation. So I think there is an example from New York City actually. They are providing support for just air conditioning in the public housing sectors. So I think it's coming from mayor's office actually. And I think the same as heat, because a lot of time older people just don't have enough funding. I mean, the funds, they think at least, to just turn the heat up. So it gets too cold for them. And by the time they realize, they just have issues. So I think, we should make sure that those, temperature control, because it's a climate change, it's actually much warmer in the summertime, but we still have winter in certain areas. That we really have to be able to make sure that people can actually keep themselves safe. Just infection control is one thing, but at the same time, if temperature is going to be a health hazard, we really have to take it seriously. Yeah.
Yeah, I mean, I really find the question really interesting. I think because we thought about these thresholds, the kind of spectrum between public and private, as something that housing operators or residents may be able to kind of go through themselves and sort of understand based on those different parameters, the type of housing, the climate, even just the community that they're in, where that threshold is for them between clean and dirty, and where they need to sort of have those protocols, additional protocols in place. And I hadn't really initially thought about it as something that would change over time. And I think that is actually really true. I think it would change both as the virus evolves and changes, as well as climate changes. And I think we could imagine that, like in winter months, potentially that threshold gets closer to home, right? It might get closer to your unit door, or even your bedroom door, depending on how many people you live with, as more people occupy interior spaces. I also think the idea of villages or ways that we can kind of self-cluster or kind of create circles of socialization are possible. One of the kind of things that we point to in the guide from assisted living or more intensive care is the greenhouse model, where units are actually sharing some individual rooms, or sort of sharing amenities like a kitchen and a living room and an outdoor space. And are there other additional opportunities for that in our housing units to group floors or groups of units together where they could share an interior space? Again, I think, the recognition is that it's not about infection elimination. We can never fully eliminate the risk, but it's about reducing that risk and doing so safely.
Okay. I want to there's a whole bunch of questions coming in about ventilation. I wanted to see if I could take one of those, and then because we're rapidly approaching 1 o'clock, I wanted to ask all of you for your closing thoughts, specifically about, what is giving you hope here, and what are your, if you could do anything to speed up the process towards better housing, safer in terms of infection control, safer in terms of the community, what would you do? But first, let's go to that, that ventilation question. So there's questions about what is the role does the panel see for greater attention to ventilation in senior housing? Are there opportunities to embed cost-saving programs systematically, like via existing energy efficiency programs? Is this something that we can actually work on right now and change given the dollars that are out there? Any thoughts on that?
I mean, I would hope so. I hope that this is a moment to really look at our sort of ventilation strategies. I mean, I think there's been a real reliance on mechanical systems, and whether those are up to date or actually being maintained and evaluated is one question, but also as we rely on them in new construction and kind of go away from, natural ventilation, honestly, in ways that we could actually create more operability within the housing. Additionally, strategies like passive house really are about bringing in higher quantities of fresh air to each unit. And so I think there's greater both understanding and study that could come from us really digging into how we create safer ventilation systems, especially for multifamily residential settings.
Sandra, are you seeing any of this in your housing?
A little bit. I think, as I said, the mechanical engineering and ventilation is really important. I do think that we need to figure out ways how to get more fresh air in. So could we do things in stairwells that then circulate through the floor? So many times we've thought about energy efficiency as tightening up a building envelope, and putting door sweeps on hallway doors so that people don't feel air coming under their front doors of their apartments, which is exactly opposite the way in which they're supposed to be designed, because you want that air return flowing through those properties and through those individual units. And so we have to figure out, both through resident education and our own education, about how to keep those systems going appropriately, and how do we measure the flow, and what does it mean, and how can we enhance that. I still like the idea of being able to throw open the windows every so often and having breezes actually flow through an apartment or through down your corridors, because I think that air handling, that fresh air handling is important, and I think we have to remember that when we go to design in the future. So for me, this takeaway for the guide is to go to both my development team and to architects and say, this is the kind of thing I want us to consider and actually design for, and it's incumbent upon the rest of us to find the resources to be able to get the design built the way in which it will be most effective and sustainable.
Thank you so much. Emi, what are your final thoughts?
Yeah, I think I really like the way that Patricia put it, just like you reduce the risk, not eliminate. I think that solution requires citizens, participation, basically. It's just not only about the building, but it's just really the building will help people to guide how effectively reduce the risk. So that's the take home. And I think the challenge that I would like to investigate further is that, I work a lot with dementia design. And I think that the people with dementia and their family members are very isolated in the communities, because majority of them live in the community. So I actually would like to call for action, basically, including myself, to really expand this, wonderful knowledge from here to be able to just serve the people who are most vulnerable at this moment.
Thank you, Emi. And Patricia.
I think what has gotten me most excited about this guide is actually the process that we undertook to get here today, and the opportunity, I think, to continue this process. I think the convening of architects, designers, developers, operators, funders together to actually talk about housing and talk about design is incredibly valuable. And I don't think it's done enough. I think there's few programs that convene people together to talk about our housing crisis. And I think that the opportunity that I see both in this process and in this webinar is to continue the conversation. And I really hope that we all take that very seriously and reach out to our networks and reach outside of our networks to help come up with some real solutions.
Thank you so much. I think, you know, the notes that I have taken throughout this, I really appreciate all of your call to action for more collaborative design, changing the narrative a bit about what we're after when we build and design senior housing, or any housing for that matter, for the need to fund the services and the programming in the spaces that we're building, not just the physical space itself, for reevaluating how we do the funding for public and other affordable housing, and for really evidence-based design. Really, I think if the pandemic will provide a chance for us to really assess some of the strategies and come up with some hard evidence that we can use going forward. That building does matter, that building design really does matter. And lastly, the comments that especially Sandra made about building trust in that in this whole process. So I want to thank each of you for your insights today. Really appreciate your being with us, and I want to thank everyone watching. Thank you for all joining us today. Thank you very much.
Thank you.